Simonov, and today we are going to talk about the pulse diagnosis and the treatment of meridians which make pairs like Tai Yin, Tsue Yin, Shao Yin, Tai Yang, and so on, with using the pulse diagnosis according to Nine Zen. So here we have again the pulse map of patient who came with glued ear, discharge for 1 year, quite large discharge from left ear, daily discharge. So what we can see, I remind again, here we have the pulse map with the meridians of the lung, heart, pancreas, liver, right and left kidney, large intestine, small intestine, stomach, gallbladder, sanjiao, triple warmer, and then urinary bladder. What we can see in this pulse map, which we make after manual pulse diagnosis, that the lung has the movement of the fire, heart meridian, movement of the metal, it is deficiency, pancreas is in excess, movement of the water, liver in deficiency, movement of the earth, right kidney is okay, and movement of the water, and the left kidney deficient, movement of the wood. The large intestine, small intestine, stomach where they're supposed to be, gallbladder deficient, sanjiao is in excess, movement of the earth, and urinary bladder a little bit excessive, but actually is compensated is compensating the deficiency of the left kidney, so it moved up to compensate this deficiency. So first of all, what we can see, how we will treat this patient. First, we can see that the lung affected by the fire. This energy comes from the heart meridian, because heart meridian become the movement of the metal and send its energy towards the lung, which start to have movement of the fire, and patient has the blocked nose, and once he blows it, he can have some red discharge from his nose too. And here we can see also, for example, sanjiao, which is a meridian which belongs to the water. It has a movement of the earth, so water affected by the earth. Humidity energy entered into the meridian, but it didn't come from the stomach, because the stomach actually has movement of the earth too. If it would go into the water and water went to the earth, but it indicates that actually sanjiao is affected by the external energy. So first of all, we will treat lung meridian using point of the fire. We will use the heart meridian using point of the metal, and we will use sanjiao meridian using point of the earth and the point of the wood, just preventing that pathological energy will disperse to all the meridians when we will follow the treatment. So what we can see, what's happened actually with the ear. If we will take the pair meridians, for example, Tai Yin, lung, pancreas. It is an excess. If we will take tsue, for example, pericardium, the liver, they're deficient both. If we will take shao, heart, kidney, they're both deficient. If we will take tai, small intestine, urinary bladder, so one is where it's supposed to be, and the urinary bladder a little bit in excess. Actually, there is not any excess, it's balanced, so they are balanced. What we will check if about the yang ming, we will see the large intestine, not excess, no deficiency, it's balanced, and the stomach, it's where it's supposed to be. And what we can say about shao yang, actually we can see that gallbladder is deficient and sanjiao, triple warmer, actually in excess. If we will see where the liver is, so actually gallbladder 2 points deficient and sanjiao 2 points in excess. So actually some disruption happened in shao yang meridian, a couple of meridians. So what happens? And what happens, the pulse explains everything. The pathological energy, external pathological energy, entered through the triple warmer meridian, affected this meridian. And the triple warmer meridian carry its energy through the meridian towards the ear. And here it is connected to the gallbladder meridian. So from this connection, it starts to carry its energy down. So what happened when the pathological energy entered to sanjiao meridian? The automatically immune system blocked it here in the ear. So this humidity is discharging from the ear, and energy doesn't go free to gallbladder meridian, making it weak. So gallbladder deficient, sanjiao is in excess. So what we are going to do, what treatment we are going to do, if we look, for example, like the Wuxin map, we can find actually in the zang organs, lung in excess and pancreas in excess, which mean the south and north, they're in excess, so energy doesn't actually circulate. The same happen here. The south and north, they are in deficiency, both. So energy doesn't flow due to this disruption in the meridians. So first we will treat using the bagua. We will treat gallbladder meridian. Gallbladder meridian is on the level of the heart pericardium meridian. So we will use the pericardium trigram, and then here to adapt it to the now for the springtime we need to change the second point here. So we will use in gallbladder meridian point over the water, and in the heart pericardium meridian of the opposite side of the affected ear, we will use the metal point. And here we have the sanjiao meridian, which actually on the level of liver. So liver trigram, sanjiao and the liver. To make it work now in the springtime, we need to change the second line of sanjiao meridian. So So we will use the second point of the Sanjiao meridian of the same affected area, and we will use point of the earth and the meridian of the liver of the opposite side. And in the end of the treatment, we need just to insert the needles. Sanjiao meridian is the earth, wood, water points, because this energy will start to go down, improving, and will go through all these points. And the gallbladder meridian, water and the wood point. So once pathological energy will go back, it will go through these points. And I used also the points close to the ears, the Sanjiao 21 and gallbladder point 2. After this treatment, the discharge stopped, and it was enough 2 more treatments that all the pulses become normal between gallbladder and Sanjiao meridian. So we can see that it was really a pulse indicated as the disease of shao meridian, which we successfully treated, and after 3 treatments the symptoms like the discharge from the ear has disappeared and the pulses improved. Thank you.